So there's a good amount of literature suggesting that the levels of omega-3s in blood is associated with better cognitive functions, and people who consume seafood have lower risk of getting dementia. However, clinical trials using omega-3 supplements have not been positive. Most of these trials have not shown benefit on cognition. We conducted a trial. We called it PreventE4. This trial was designed to test the question whether higher doses of omega-3s given to individuals who have a genetic risk for dementia based on carrying the ApoE4 allele would benefit. We have published in the past that E4 carriers with dementia have lower delivery of the omega-3 to the brain. So if we started before, if we started when they were cognitively normal, is it possible that we could potentially decrease the risk of dementia? So PreventE4 was a 2-year trial. 368 individuals were randomized to placebo versus high dose, 2 grams of DHA per day over a period of 2 years. And we presented these findings in CTAD. The paper has not been published yet, but the major findings were that higher doses of omega-3s were able to penetrate into the brain and equally between E4 and non-E4, suggesting that we actually targeted the population early before the limit in brain delivery for omega-3s. However, we found that the actual omega-3s over 2 years, the supplements, did not affect either cognition or hippocampal volumes, which is a measure by MRI. That meant that the supplement was not effective. Now, does that mean that omega-3s have no influence on brain function or cognition? The trial had very interesting insights. When we measured the levels of omega-3s in CSF, which is cerebrospinal fluid, that's a marker of brain delivery, we found that the higher amount of omega-3s in CSF were associated with better cognition. This signature was only seen in those who carry the ApoE4 allele, and it was seen in both the placebo and the supplement arms. So what does it mean that higher amounts of omega-3s in the placebo is associated with better cognition? Remember that the placebo arm was not taking supplements. So how come that they have an increase in their omega-3 levels? So I think to answer your question, we need newer studies to understand what determines a higher amount of omega-3s in the brain. If it's not the supplement, what is it? Is it possible that a higher amount of omega-3s in the brain reflects not just the diet, but possibly a lifestyle or another form of risk factors that we're not measuring? We know, for example, that exercise, obesity, smoking, other risk factors can actually affect the metabolism of omega-3s. And it is possible that we may need to design interventions that are multimodal, that involve many components. And in addition to that, more omega-3s in the diet, and test whether these combined interventions can lead to more brain omega-3s and better cognition. But importantly, just taking the supplement without changing anything else in your lifestyle was not associated with any improved cognition in this trial.